much storage there is in the cloud.
I don't know how much. Well, there's probably more than what's in my computer, but let's see what happens. I just pressed it.
Perfect. Thank you.
Okay, we'll see what happens.
Amazing. Yeah, I can see it's recording. Great.
How can you see that?
Because it says REC, record, with a red little thing.
Oh, I guess that means it's recording. Funny how that works. Okay.
All right. Thank you.
All right. How are things in the factory?
Baruch Hashem. We missed you at the faculty meeting today.
Okay. So we're still solvent. Hi, Toby.
Hi, thank you.
Welcome aboard. So do I have everybody's, what do I got here? Pieces of paper like crazy. So somebody is going to be at a wedding. Darcy's going to be at a wedding. Is Tuesday night a big wedding night? Because somebody was at a wedding, in the class a couple of weeks ago.
In the Jewish world, every night is a wedding night.
All right, we'll take it. Okay.
Esty, would you be the person who will do the course mapping, or that's Bela?
I'm not sure I understand your question. We have a course map. I'm not sure if you're asking for advisement, or like your personal course map, or like the course map.
We haven't seen the courses, how it follows through till the end of the semester, till the end of our program. We just see this semester. We don't know what's coming up in the upcoming semesters. I would love to see.
You might want to thank me. You might want to thank me for that, Chaya.
Right? Thank you.
Yeah, there you go. Well, I can comment on some of it. I mean, our class is a full year class, so to speak. So we will continue with generalist practice too. The rest of it, I do not know about. But I have discussed all of that, and we will be continuing through, I guess, the early summer. And you will have completed your 2 semesters.
Oh, just 2 semesters? I was under the impression you do 4.
Practice. Well, no, that's just generalist practice. And then after that comes, you have to specialize and choose a method that you're going to stick with: clinical practice, group work, etc. So there's more decision-making yet to be. And then there's electives and stuff like that you're going to have to jump in on as well.
Okay. Thank you.
But I don't have that roadmap. But someone's got that, right?
I do have the roadmap. I was just joking when I said you might thank me, but you might after you receive it. So I will Blinetr, I'll send it out this week. I have to be very honest. I came on board, like just days before you started your orientation. So I'd like to go through the roadmap and just make sure that there aren't any errors, and proofread it, and that kind of stuff, and just make sure that you're getting the correct information, and then I will send it out to you this week. I'll send it out in a mass email.
Perfect. Thank you, Esty.
Pleasure.
All right, we're filling up. Three, 6, 9. We've got a bunch more coming in. Who's in placement? Is there everybody in placement so far? Nobody, no. How many are in? Oh, really? Okay. I know she's working feverishly to get this all pulled together in the next couple of weeks.
How many are in? I couldn't see the answer because I'm on
this point. Sarah, I think, may be the only one.
No, I know Esti's in placement, and Toby said she was going
to start. I'm going to be starting in about 10 days.
Oh, okay. Toward the end of the year.
I'm supposed to start in a few days also.
Kaya, Alan, I know you're, Canada's a little bit tricky to negotiate, and I spoke with Deb 2 days ago, Monday, I think, and they're trying to find things. It's difficult because it's the middle of the academic year, and I guess a number of schools have already got their students placed. But they'll get it together. She's got interviews and all kinds of stuff. She's tenacious, so that's good.
Right. I felt like there's no need to bother her. She's on top of it, and she's going to let me know when she has something.
She has taken this responsibility very seriously, and she's doing everything she can. So eventually, there are a number of assignments that are tied to placements. So in the event that there are not, people are not placed, I will reconfigure the assignments so that it's not problematic for you. But right now, we're in kind of a assignment lull, which is fine. It'll probably pick up 2 weeks from now, but we'll see. We'll see. So how many? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So it could be that Darcy will not be joining because she's at a wedding. So let us talk about this ethical dilemma. Hi, Kaya. You're in darkness.
I'm really sorry. I'm in a car, actually. So, yeah, I was running a bit late. I'm sorry.
All right. Well, join in when you can. Are you outside?
I'm in a car. I'm in a car right now on the way home, actually. So as soon as you see me in light, you'll know that I got home.
Okay. Well, get home safely.
Thank you. I'm sorry.
So
Thank you.
let's talk a little bit about this ethical dilemma. And I think some of my comments on your your responses, the biggest concern I think I have, and I may have shared it with a number of you in my responses, has to do in part with the fact that this is a gal who is an acknowledged drug abuser, violated a court order. She is living under an alias, etc. She has done a number of things that would suggest that she is creative, protective, and manipulative. And it is very tempting, it was very tempting, even as I read it the first time, to kind of empathize with her predicament. And as I thought more about it, my concern revolved around the fact that, and especially I got toward the end of the write-up of the case, that she violated a court order, that it puts her in some kind of jeopardy in terms of going forward and a divorce. It puts her child in jeopardy, perhaps. And there might have been other approaches that she herself could have opted for. And so our tendency to assume that everything that she is saying is completely correct, I'm raising this to say we need to be a little bit more suspicious. I don't know if suspicious is the right, cautious, maybe that's a better word. Because here we have a gal, again, who has done some very questionable things, and may have put herself in major jeopardy and her child in major jeopardy, so that if she is found, for example, having violated this court order, I see a hand, Ashley, just one sec. If she is found out that if she's found by the husband, she'll never see that child again. The husband will get custody of that child. So on some level, she may have put this child in more jeopardy than not. Now, it still leaves us with an enormous dilemma. Like, what do we do with this gal? And we'll come to that in a second. Go ahead, Ashley, what's up?
I was just going to say the first point you made, I also made when I was reading it, because as I was reading it, I kind of like felt for her, like, oh, she's so protective, she's being such a good mom. And then I'm like, wait, she did something crazy. But it's hard to like see that right away. Yeah,
she has done some questionable things. She truly has. And her husband is accused, she accuses the husband of, well, let me read it to you. She says that he was abusive, physically abusive. Maybe he was. Maybe everything she said was 100% accurate. But I don't know that I would, if some of those other areas of her behavior were not known, I would have a different feeling about it. But here she is after the third week of, at the beginning of her 10th meeting with the social worker. So she had now 2.5 months of meeting with this social worker. She then shared the secret. I can understand why she'd be hesitant, but 10 meetings is a lot of meetings with a social worker. And then she owned up to it. Sarah, go ahead.
Sorry, maybe I misread something, but I thought it said that he was emotionally abusive to her, not physically abusive.
Emotionally, it may well be.
Right.
You may well be right. But what do we know? Maybe he was abusive because she was stoned out of her brains because she's a drug addict.
Right. I think what Sarah is saying is that there's no point of physical abuse even. So
But even
we
emotional.
don't know so much about him,
We don't
but
know.
we do know about her. That's what you're trying to tell
Well,
us,
that's
right?
what I'm saying. And that's often the case, that we only know the person who's sitting in front of us telling us their perspective on the situation. Absolutely. Yeah. But what made me uneasy was living under an alias, violating a court jurisdiction, the drug abuse. I put those pieces together and I'm saying, I'm uneasy. That's all I'm saying. I'm not saying she's an outright liar. I'm saying I'm uneasy. Toba.
So I also, when I read over the case study, but after doing the readings in the Shoma book, it could be, first of all, we don't know, but one side is that it could be she wanted to protect her son, so she really meant good and well for her son. So the first few sessions, all she was focusing was on her son, on her son, on her son.
Yeah.
Now, I'm saying it could be she wasn't that bright, that she didn't realize, maybe she did it, but maybe she was also in denial. That, it could be that she's running away, is she didn't put the two and two together. That's, it could be, anything could be. But when I was reading the Shoma book, it takes clients different amount of time to warm up, to feel comfortable enough to share their feelings. So it could be even more so here, she was hiding it. So until she felt that comfort level, each client has their own comfort level, no? So it could
Agreed. She was seeing on the other hand, and I don't know whether I don't really know how I feel about her honesty. I know there's a couple of red flags. What I would also say would be that she was seeing, okay, so let me carve a path through this for you. What could have perhaps been a reasonable approach? Well, and first of all, there's a whole question of a dual relationship. The son was her client, and then the mother becomes the client. So we have the question of dual relationships, which we know is often a no-no. That perhaps it would have been better for her to have someone refer her to somebody else and maybe have joint meetings now and again. Yes, Ashley.
But let's say you're doing family therapy, doesn't stuff like this come up anyway?
Yes, but she wasn't doing family therapy.
But I'm saying in a situation of family therapy, let's say something like this would come up. Who would
It could come up, sure. It could.
So how would you handle it if both of them are your clients?
Well, it's in family therapy, you'd have to.
In any type where they're both your clients, because then you can't give precedence to whichever one is your client.
Because it becomes, how do you define the client? The family is the client. It's not the boy or the mother. It's the family is the client. What's the dynamics in this family that are creating tension, difficulties? Maybe the kid is acting out because of all the difficulties in the household. The client is the family. And that is how we approach family therapy, which we'll discuss in another 2 weeks or so. The client becomes what's going on in this family. It could be that in a family, Johnny is drinking. He's a high school kid and he's drinking and he's not going to school. And you would have to say, well, and the family is there. Well, the problem is Johnny. Well, no, the problem isn't Johnny. The problem is, why is Johnny doing this? What's going on in this family that is provoking Johnny to act out? Is he not getting attention? Is he competitive? Et cetera, et cetera. It's really the definition of the family. In a family approach, it's the family. So going back to our situation with the child and the mother, right away we have a dual relationship. Should that have happened? Well, it's not the worst catastrophe in the world. it's kind of understandable that she would see both of them. It's not the best practice, but understandable. Okay. So then we have the whole thing about the fact that she transported a child across state lines. She literally, no matter how we want to look at it, kidnapped the child. That's what she did. Again, understandable, yes. If everything else that was being said is true, that the husband is emotionally abusing her, that the kid is, there's all kinds of problems, et cetera, the relationship with the husband is totally toxic, etc. She may have done the right thing, but she did violate the law. She took a child from one state and moved a couple of states away. This is illegal. And it puts her in greater jeopardy, again, in terms of trying to get a divorce that would be equitable. She's made it much more difficult for herself. Yes, Malka, Mo.
Sorry. So my question is, being that the kid is a child, so that's why it's kidnapping, right? So that's
called kidnapping, yeah.
Right. And being the fact that it's a child makes it much more severe. Because the child doesn't have so much control, right? If it would have been an 18-year-old, it wouldn't be the same idea.
An 18-year-old could say, bye-bye, you're on your own.
I'm saying it wouldn't be the same idea. This is very harsh because it is a child.
That's why it's called kidnapping.
Napping.
Yeah.
Right.
Yeah, that's where it comes from. Kaya.
So I didn't even focus on the kidnapping, but is kidnapping, would it be considered something that you would have to give over to the police? Because
that's the next bunch of confusion.
Because I said just avoiding a court order, evading a court order is problematic, but kidnapping is another level, but it's not anywhere clear in the Code of Ethics.
She transported a child across state lines. This is called kidnapping.
Right,
Now,
in Code of Ethics, it doesn't say anything about kidnapping.
Well, the question becomes, what takes precedent, the safety of the child or our legal obligation? That's over here someplace. That's just to put in your back of your head. So the next question is, again, the whole question of a dual relationship. But what could one do? So to go forward. So again, we have the whole question of the confidentiality of alcohol and drug abuse. The mother acknowledges that she's a drug. She's had problems with drug. She's had addiction problems. Are we obligated to make something happen from that? No. And again, you go back and forth because we're swayed by, in many respects, we're swayed by the situation with the child. Let me explain why I'm picking this to pieces. And I'll give you a path through it. I'm picking this to pieces primarily to say that, first of all, ethical dilemmas can get really sticky and really confuse us big time. Okay. Which is why the code suggests we talk to colleagues, that we talk to legal people, and this is really what would be the path through this. You would consult an attorney, somebody who knows the law and law enforcement about what she has done, and see if and explain to this law person who might understand all of this, who has law enforcement and legal understanding of this kind of a situation, that what could she do, what should she do? Should she go back to the state and own up to it? Should she stay where she is? Should she inform somebody? I don't have the answer. I don't know what the legal ramifications or the legal expectations would be. But she certainly has set herself up for a situation that could be very dicey and could really mess her up more than it was in the beginning. Because she violated the law and took this child away and set him up with an alias and herself up with an alias, that's not so simple, by the way. She had to get a social security card. She had to get a driver's license. This person knows how to work the system, systems. Okay, so I would help her. The help could come in terms of setting her up with somebody who knows the law to advise her on how to proceed. Should she go underground? Should she keep quiet? Should she own up to it? Should she get in touch with the state authorities here, there, where? That would be one part of it. And should she, how much disclosure should there be? I can't answer that. I have no understanding of that. The next question I would have would be, should she get in touch with some not foster care, the child welfare, and find out what should be done in terms of this child in the event that she is taken from him, if the mother is taken from him? What happens? I don't know. And my lack of knowledge might be more dangerous than anything else. My lack of knowledge might impel me to say, well, do this, that, it'd be a good idea if you tried this. My lack of knowledge would say, mother, I think what we should do is I'm going to consult with an attorney. We're going to talk to a child welfare person and see what to do. That's how I would want to proceed with her. And I think we all, myself included, when I first read it, I said, oh, poor gal, she did the right thing. She's trying to protect her kid. Malka.
Yeah, I agree with you that we should do that thing. My question is, by telling her straight out right away that this is what you would do, aren't
not right away. First of all,
okay, because that's what I felt like. I felt like right now I need her cooperation. If I'm just going to tell her this is what we're doing.
This was in the 10th session. So already we have our relationship going well. And that's when she felt safe.
But once she says this, right, she is going to be very careful about how the therapist will react. Obviously, she waited till the 10th session.
That could be.
And so my question is, we don't want her to run away now.
No, we don't. Not at all.
So that's what I'm saying. We have to be careful about that.
Yes, you'd have to take steps and make sure it's clear to her that you're working with her, not against her. That we have a real tough situation here. I didn't realize all of these pieces, and now we have to really address these pieces so that we can, protect you. Now, it could be with all of the best of our sincerity. She could be in a real pile of trouble. But better we should know that. And if a lawyer type says, well, she has two choices. She could continue this way and nobody will ever find her. And you're taking the chance that, or we should get back in touch with that jurisdiction and see how they might want to go forward. But better to understand this than to just pretend it's all okay, because it's not all okay. Toby.
What happens if she feels threatened and she thinks that you're going to go report her and she says, well, if you're going to help me?
Well, again, this is the 10th session. She knows that you've been helpful. She's been
right, but you can really get her angry and say, well,
she could do that, and it's a chance that you'd have to.
She'll walk out and never see her again.
I don't know about that. I mean, if after 10 sessions she feels
my way or the highway.
Well, maybe. In which case,
she obviously is a very creative and manipulative person.
That's true. But I think how you present it to her, how you deal with her at this particular juncture would be crucial. I mean, you'd have to say, I want you to understand Mary, Sue, whatever, let's call her Sue. I want you to understand, Sue, I have concerns based on what you said last time. And maybe not throw them all at her at the same time, but say, I'm making it very clear to you, I'm really on your side here. I don't want anything to happen to your son. I've grown very fond of him over these last many weeks. And whatever you have to say to reassure her, because you aren't her enemy. She's really her own worst enemy, frankly. You're not her enemy. You're there to try and sort this out. Let's see what the people who know these things will tell us, and then we can figure out what to do from there. I mean, you don't necessarily want to poke around without telling her that you're poking around. I mean, you're not going to say, on your behalf, I spoke to somebody and this is what they said. I think you have to tell her that this is going forward and you're doing it to protect her and to make sure that this ends well for her. It may not. It just may not. Not because of anything you've done, but because she did some things. Simi. Okay, so it's sticky. And I think what for myself, and myself included, the first time I read it, as I said, I was very taken with her predicament and felt sorry for her. Would I have done the same thing? Maybe, maybe in a moment she said, I can't take this anymore. He's abusive, and the heck with that court order. But she knows how to work systems. She set up an identity. A child is enrolled in school with a false name. She's interesting, for lack of any word, and maybe a formidable situation. Anyhow, that's unless there's anything further we want to pick apart on this. Fortunately, in much of our professional lives, this complexity, this level of complexity, is not necessarily going to emerge, but it does brings up for me, and I guess on some level for you as well, it brings up the dilemma of when we only hear one side of things, and we're hearing things that don't necessarily, 1 and 1 is 17 instead of 1 and 1 is 2. We may have to slow down a little in terms of, can you explain this a little bit further to me? You got it? Let it go? Okay, fine. All right. And I think the biggest sin that we all might make is that we're kind and empathic. And we have a child that's involved, a young child who's clearly suffering, acting out in school, fighting with other children. Something's going on with this little boy, and he's having a tough time. And this little boy doesn't have a father. So if they had stayed put and negotiated a divorce, this child might have some time with his father as well as with his mother. She did something that, again, I think we can all understand if indeed there was any kind of emotional abuse, but still. Kaya.
The one factor which I mentioned in my report is that he was able to hire a divorce lawyer right away, as soon as he got the threat. So there could be some form of social injustice here, that he has the finances, he's in charge of the finances, and she's going to be left out in the cold.
We don't know anything about that, but by doing this, she's also deprived herself of any kind of alimony payments that could help her as well as her son. I mean, it may have been difficult for her to stay there, but in the long run, it might have been the better thing. Simi.
A while back, maybe I would have been suspicious also. Like you said, she's addicted to drugs and stuff like that. I actually have a family member going through a very messy divorce. And I think sometimes I would think, yeah, just pick up and run away, and who cares if it's illegal, even though it's completely illogical. And like you're saying, in the long run, it could make the person in a worse situation. For some reason, when I read this, I didn't doubt any of the things that she said. And I think the goal here would be to just have her understand that you don't want to get yourself in a spot that's going to be bad for you legally, and try to get her I wrote basically to maybe get her in touch with a women's shelter or something like that. Maybe they can help her, and they would know also maybe legally how to kind of get her out of this.
Yeah. I think it would have been better in her long run for her life if she had consulted somebody while she was still in the jurisdiction. She could have gotten an order of protection. She could have gone to a shelter. There probably were options that, because of her distress, she didn't see them. And so in the long run, she may have sabotaged herself more than really helped herself in the long run. But we don't know.
Right. We can't know.
I will never know.
Mm-hmm.
Alka.
Well, in the long run, we don't know anything, but it's pretty obvious that she self-sabotaged a large part of it. As much as we can be empathic for her, we can also realize, a judge is only, everybody views their job according, a judge is a judge. And if he hears that she crossed 2 states, and he as empathic as he is, he can't override that, right?
Judges are not as empathic as we might want to think.
I'm saying, but even if he would be, he cannot, I'm saying she did something that he's bound by the law. He's the judge.
Right.
I'm saying as horrible as the law may sometimes be to a person, breaking the law is still backfiring at the person, because then even if it's horrible, but it's still not giving them a chance, because the minute the person broke the law, they put up enemies against them, the laws against them.
Yes, but again, in terms of how to go forward with this case, how do we handle any of this? I'm saying that I think what might be the best approach is to find out how much trouble is she really in.
Right. So that's why I think a lawyer that specifies in these type of things.
And is there any way that she can make it better for herself?
That is true.
Yeah.
That is true.
And but again, as Toby points out, we have to do it very delicately,
right,
and with as much empathy and sincerity. I mean, it really is sincerity. You've now seen her 10 times. She has opened up to you. You've seen her child. You know a lot of her situation. And so you don't want to be harsh with her. Let me have a final comment.
Yeah, sorry, I know you want to move on, but I was going to say, maybe also find out more about this court order. Like maybe there were certain conditions to it, and I don't know.
No, we don't really know.
Mm-hmm.
And a lawyer, a legal, someone who knows the law would have to advise us, and then we would have to convey some of that to her and hope for the best. But again, what makes it a little bit more complex is the child. And so this child, again, is fatherless, living with a name that is not his own, et cetera, et cetera. She did something to protect and might have, again, jeopardized herself more so than not. And all I say, or the only reason, again, I'm hammering this with you, is to say we sometimes have to look past our own empathy when there could be so many. This is, hopefully you'll never have a case this complicated. I have never had a case this complicated in 20 some odd years of practice. So rest assured, we diced it up to make it as complicated as possible. Nevertheless, it's believable and very believable, and probably based on some case that somebody had. Okay, can we say goodbye to her and hope for the best for her? Absolutely. And she sounds like a nice person who's kind of gotten herself into a mess and wanted to do the best thing for her child. Understandable. That part we can all relate to. All righty. I think you have done some reading on assessment. So I want to go over some of this in much more detail perhaps than not. And when one does an assessment, again, some of you are in placement, some of you are not. When you are, let me put it to you quite clearly. Whatever assessment you do is driven by the agency in which you are housed. I will end up this class giving you a whole format, if you will, for an assessment, a very broad-based format. But as I say, the assessment will be driven by what the agency expects you to put together. I'm giving you all the contingencies that could go into an assessment and why we would do them and why they're important. Some of this may not be what your agency expects or needs or wants. Nevertheless, I will, and that's, when you're in placement, you'll know exactly what I'm commenting on. But I would say even before we start to talk about the situation with the client, whatever that may be, even before we start that, one of the first things that you have to make a determination about is whether this place, this agency, is right for the client and whether you are right for the client. So, and that's before we hear anything about them. Did they come to the right place? And do you have the knowledge, expertise, whatever, patience, whatever we want, whatever. Do you have the package that this person needs? Let's start with the agency. If you're working, let's say, in a mental health agency, and someone comes in and has a very striking history of mental imbalance and profound mental illness and is in the midst of some kind of a psychotic moment, a profound emotional upset and they are really not handling it at all, and they seem to be coming apart at the seams psychologically, you're probably not the place for this person. This person perhaps may need to be at an emergency room where they could work with him or her more conscientiously. If someone is coming to your agency and they have serious addiction problems and your agency doesn't necessarily work, has nobody on staff who is educated, sophisticated, knowledgeable about addiction, send them to an agency where there's addiction. If you have a woman comes to you and she needs protection of any kind, we have to send them to a shelter. And so what I'm saying is, do we have in this agency the wherewithal to take care of this person adequately? Number one. Number two, do you have, as the clinician, as the social worker, enough understanding of this condition to be able to really help this person? Now, I realize I'm talking out of both sides of my face at this point, because on one level, I say most of us are generically trained and we can handle most problems. But sometimes there are situations that are so complex that they, first of all, do not belong with a first-year student. And that's the other thing. You're new at this, and your field instructors have been told that they are to assign you cases that are not necessarily the most complex in the agency, that they should be acknowledging that you are a first-year MSW student who has not necessarily worked all that much with clients, and they should be giving you case assignments that are not necessarily the most complex cases in the agency. Another situation that might crop up, someone comes to your agency and they're struggling with a medical diagnosis, and you really don't have the wherewithal to be able to be not necessarily addressing the emotional stuff, which I think many of you could, but some of the medical issues that might come up. Anyhow, the gatekeeper role would be, is this the right agency for this person? Can we handle this person's situation? Again, someone has a major psychiatric disorder, they're suicidal, et cetera, it may be that this is a little bit too much both for you, and unless there is a specialty person in the agency who could handle alcoholism, for example, or heroin addiction, they must be moved to someplace else. So that's the first, for me, the very first line of assessment. Okay, they're here and they're yours. So there's loads of information that has to be gathered during the assessment, which again, as I said, we'll spend most of our class doing this. But I want to, before getting into the details of this, I want to differentiate between a diagnosis and an assessment. And they are two very distinctly different moments, if you will. Now, in a diagnosis, let's talk about what a diagnosis is. And just the word immediately strikes that this is a medical model of care. So when we talk about a diagnosis, we are looking to identify a problem that exists. That the diagnosis is always looking at what's wrong with this person. And that's what a diagnosis will give you. It will give you an analysis, if you will, of what's wrong with this person. And the DSM, the Diagnostic and Statistical Manual of Mental Illness, which is used in all agencies, is a big fat book. Big fat, must be 500 pages. And it lists every mental disorder on the planet. It gives each of them a number. And when you diagnose someone, you have the agency will go to the DSM and put on the insurance form 396.7, 396.2, whatever it is. And based on that diagnostic category, insurance companies will pay for the sessions, for the time. But underlying the whole notion of a diagnosis is that it is not quite so multidimensional as an assessment. It is not necessarily looking at the bigger picture that surrounds the client. It is not necessarily looking for strengths, which is, again, what we do, we in social work do. And it's got a whole, it reeks of the medical model. We have, over the decades of our evolution as a profession, we have moved very strongly away from a medical model. And we do assessments. So let's talk about what is an assessment now that we know what it isn't. An assessment is a multidimensional view of the person who you're seeing's problem. It's multidimensional. And in some ways, it looks at the social nature of the problem. It looks at what is going on around this person, which contributes to the problem. And so it involves an understanding of this circle, put the person in the middle, and then there's a circle around them that influences the situation for the client. So when we do an assessment, there's loads of things that we look at. Let me also comment on the fact that an assessment initially has to be done in most social work settings. It's expected that an assessment will be created around the person's situation. Yes, that's to be expected. But I will also say that it tends to be somewhat fluid. So assessments can be done obviously very early on to kind of give a focus to the work that you want to do with this client, because the assessment will flow into setting up goals and prioritizing the goals, and then to an agreement between you and the client. So the assessment tends to have a fluidness to it. Initially, it would look one way. 5 weeks down the trail, it may look very different. And so it can be seen as a document that changes over time. Initially, it is very focused on what's going on with the client at this point, why they are coming for help, and what's going on in their life. So there are a number of things to consider. But one of the bigger pieces of this is that moving away from the diagnosis, the notion of a diagnosis. Diagnosis, think about it. You go to a physician. What's wrong with you? Well, it hurts when I cough. My chest hurts. I'm going to diagnose you with, let me take an x-ray. We'll diagnose you with pneumonia. Okay, it's a diagnosis. And I have a specific treatment, and we're going to go with it. We are not only not that rigid, but we look at a lot of other concerns that we have that can influence the creation of the contract and the goals that you're going to have with this client. Okay. So, let me turn some pages and talk about what is to be asked. Now, there are general categories of assessment content. Obviously, you want to know what's going on with the person, what's their emotional life, how they're coping. These are just general areas, and then the specifics of each of these areas will be gone through. So you want to know what's going on, what's their coping style, what are their skills, and essentially what supports do they have in their life. These are like the biggies, the big components of the assessment. So, one of the areas that we take into consideration is what's called a social history. And again, I'm going to give you a lot of possibilities for an assessment. I'm repeating myself about the 18th time, which I tend to do, saying that whatever your agency requires of you is what you will do. If the agency has no expectations and you just have to write it, you can follow some of what I'm suggesting this evening. So a social history. What's included in a social history is a description and history of the problem. So once you do the why are you here, what's going on with you, you try and get a whole lot of background information about the problem and about the person with the problem. Helen Harris Perlman, who was a very prominent name in social work, she was at the University of Chicago in probably the 1950s. And she said a person, there were 3 P's, a person with a problem comes to a place. And so we need to find, and we are the place. We now have to find out about this person and the problem. So the emphasis is the dual purpose of the assessment is to get some of the person and the problem. We want to understand who this person is, kind of what's their story, if you will, and then we want to look at the problem itself. So we do what's called, again, a social history. So what goes into that? Well, you want to get a sense, perhaps, of the family composition. Who are the people that you live with? I want to have some background on you. Where were you born? Give me a quick rundown on where your childhood was. What are the significant relationships that you've had over time? And again, this is much more detail than you probably will ever have to accrue. But it can all weave itself into a composite. And again, I go back to each client is a huge jigsaw puzzle with many, many pieces. Some of the content that I'm suggesting right now would fill in some of those pieces. Employment history, educational history, and again, these things can be answered in 3 lines. John Jones comments that he was born in Chicago, 2 loving parents, his father and mother were both college professors. He went to high school, has 2 siblings. Again, it's a paragraph. It's not a book, but some of this background stuff is helpful. In your syllabus, so I think in one of the modules, we have provided you with a biopsychosocial spiritual assessment form for both individuals and families. Download it, you'll see it, it's there. If not, I'll send it to you, but I know it's there. And so one of the areas that looks at, which I think is a consideration here, is what are your religious activities? How connected are you to a spiritual life, to a religious life? And again, in your community, I would imagine that most people would have a very committed religious experience and a religious component in their life, which may be very crucial to how they live their lives and explains a lot. And are they truly engaged in the community's religious observances, et cetera, et cetera. So you would want to include some of that, and how involved are they in the religious life of the community. One area that is very often overlooked in assessing a client is the medical history. And it may not even be past history, but that could be significant. It also could be that they're being treated for something currently, which might influence their particular situation. For example, someone who has heart problems may not have the energy to work full time. Someone who has a thyroid problem might be in the midst of being worked up for a thyroid problem. If one has an underactive thyroid, they tend to gain weight and tend to be kind of slow moving and tired a lot of the time. That might be an important factor in what's going on with them. Someone is being treated for an oncology issue and they're well, but they still require attention and certain kinds of treatment. Okay, so this is there, and it's answered by, are you being treated for any current medical conditions? Cross it off if they're not, but some of it might have an influence on their functionality. Yeah, I have this thyroid condition, and even though it's being medicated, I find myself by the end of the day, I can hardly move around. So it impacts my social life, it impacts my family life, et cetera, et cetera. That would be something worth knowing. Yeah, Tova.
You asked them straight out?
Well, the way you asked it, can you tell me if you have any medical issues, current medical issues?
I know this is like the original interview and assessment, but would
This,
the client be a little bit hesitant in the beginning? They don't know you and like they're giving out some like confidential information?
well, I guess it's confidential, but again, in the way it's part of a package, if you will. It may not be
Right.
the first thing you ask. I hear what you're saying, that somebody might be very
Like
reluctant.
if you come to someone that you don't know, all of a sudden they start asking you, okay, so do you have any medical conditions? You're like, I don't know who you are. Like, you know,
Yeah, then you might get that response. I have to say, I don't know that I've had that kind of reluctance, but the other thing is, in agencies where I have worked, there's a form that people fill out
right.
and check off stuff. I don't even have to ask, and I'm thinking of the second agency that I worked in. I never had to ask. They had to fill that out.
Right. Isn't that much easier? Especially today's age, a lot of agencies have like a tablet.
Well, if they have it, then you don't have to ask it. You just have to look at it and see if there's any. But you might look at it and say, oh, I see you on your medical form that you have a thyroid condition. Is that affecting anything in your life at this point? No, it's completely under control. Okay, great. Moving right along. It writes on there, I have a history of migraine headaches, which can be completely debilitating. I've never had one, but I've heard enough. If you could say, how often do you get those headaches? Is that a problem for you? It's just another piece of the puzzle.
Do you find from your experience that, I'm assuming maybe it happens that let's say clients do have some issues and they don't fill it out like by the assessment because they're hesitant and then it comes out like the second or the third session?
Probably. I can't remember anything quite that specific, but I wouldn't be surprised. I appreciate what you're saying. There may be reluctance. I mean, certainly nobody's going to comment if I was going to say they're not going to comment if it's really kind of a complex situation for them. I can't think of anything off the top. I mean, certainly sexual problems, they're never going to be discussed. I mean, that's just not going to happen. And even down the trail, that kind of discussion probably wouldn't happen. But somebody being treated for an ongoing urinary tract infection, they may be uncomfortable saying that. I have frequent prostate problems. I mean, a guy might have a real terrible time saying something that to a social worker. Anyhow, I can't recall anything specific, Tova, but it probably has happened in the past. And again, and I appreciate you being sensitive to that, because indeed that is a sensitivity. All right. So let me just ask, out of my own ignorance, as women, would you be expected to do social work treatment with men or just with other women? Well, are there any practice prohibitions I should be aware of? Hannah.
Sorry.
Go ahead.
Okay. So when I worked in a clinic, the basic rule was that women can see boys until a certain age, usually like 12 or 13, and they can see girls and they can see women. Men, therefore, had way less clients. So in the clinic I worked with, we had about 50 social workers, school psychologists, and the men had less clients than the women.
But the men could see women clients?
Oh, no, just men.
Yes, men.
And then we had another problem where some mothers did not want men seeing their little boys.
Oh.
Just because of fears with today's, sexual abuse. So, or they felt that a woman's touch is warmer and they just preferred a woman therapist for their boys. So basically the women were seeing all the children, teen girls and women, and the men were seeing teen boys and adult men.
Okay, so the expectation for all of you in placement would be that the primary base of your, no?
That was in that
where you're placed at. If you're in and even then, and I think even here, I think people have a preference. It's not an issue. If a woman does want to see a man, even in the clinics here in Bikur Cholim, they allow that. I think it's
So
not,
sometimes it's not, no, it's not a black and white law, meaning that was the way there was a religious clinic, that's the way it ran. But again, if it was an older woman, maybe, and it was, they made exceptions. It wasn't, but that was the general premise. But I just remember advice I was given that one of my colleagues told me, just said you shouldn't see men. You don't want to be taken advantage of, and vice versa. Told men that, men seeing women in such an intimate relationship, that's led to problems in the secular world with therapists.
Well, how do you guys feel about, would you be uncomfortable doing a workup on a man? Simi, go ahead.
I mean, at this point, I'm going to say yes,
Okay.
but it depends what you're talking about. Like, if it's more of a, I don't know what the term is, like a therapy kind of situation, or if sometimes some social work agencies, it's more technical aspects of their life. In that case, I don't know. Also, again, depending on the agency, I don't know what the expectations of things would be. I don't know if I'd be uncomfortable in that case. But again, I don't know where I'm going to be placed at this point, so.
Tova.
No, but but marriage counseling is totally different. That I think.
That's a different story.
Oh, okay, fine.
That's
Okay.
a different story.
Okay, fine.
Well, family counseling, the whole family comes in, but I'm saying is it an inappropriate expectation that you would be doing any kind of counseling with males? Welcome.
I believe it's just, I think we've been through this a lot. It's exposure, right? So it may take time to develop it, but I believe as social workers, it is not something that we cannot get to without, it's something that we're not accustomed to maybe, but it's not something that cannot happen.
Well, I would also imagine it would be difficult on either side for a man to be conversing with a woman about personal stuff.
Probably.
And,
but I think it would be a lot dependent on the client. What does the client want to see, a male or a female? Because I think that will always be listened to. Whatever the client's going to ask the client is going to get that. So obviously, if it would happen that a man comes in, it's just because he wanted that. So then again, it's every situation. I think we have to learn. Everything is a learning.
Yeah, I realize that. Obviously that's why you're sitting here, but
right.
Wondering that even as we talk about some of this, would it be unusual for you to be counseling a male? Kaya, go ahead.
Well, in Toronto, we don't have clinics with just religious people, unfortunately. So wherever I'm going to be thrown into for placement, I'm going to be exposed to everything, most likely.
How would you feel about that?
So I haven't really put much thought. I feel the exposure will be healthy and I'll hopefully be able to gain and grow from that. In my community, we don't have so many trained religious social workers that I may have to deal with the Orthodox population, males included. I don't know what I'll be up against.
Yes, Steve.
So it's funny, I'm like thinking about it, and I think that if somebody wasn't Orthodox or wasn't religious, I would not have a problem working with a man, but I would have more a problem working with Orthodox or religious men. I'm not really sure why, but it just, to me, somehow it feels more normal to be working with somebody who's a man and he's not Orthodox. But I feel more comfortable even having discussions with men that aren't Orthodox, but men that are, I don't really talk to very much.
Well, that's the question. If an Orthodox man came into the agency with a problem, would they immediately assign that person to a male? And
most likely they would, I think.
It was available, and they assigned this person to you. Would you be uncomfortable with that, Hannah?
I'm not really sure what the exact laws are according to like the Torah. I don't know, but I personally won't take males as clients. That being said, within a limit, like as adults. So I'll see teens, I will see children. But at a certain stage, I say no, and I say I can refer you to someone else.
Well, going back to Tova's question, would a male be forthcoming, an Orthodox male be forthcoming about sexual problems or emotional problems? I would imagine it would be a very difficult transition. Tova.
I've had quite a few who come to me and they wanted me to be their therapist with that. Like I was seeing their wife or their child, and then they came for a parent session and they were open about these things, and it made me very uncomfortable.
Okay. Tova.
But then I have a question then, according to Hannah. But usually, isn't it more, if once a family seeing one therapist, shouldn't they all be like, it would be counterproductive if this, let's say, husband, father would go to a different therapist if they're doing family therapy?
No, if he wants individual therapy for his own issues.
For his own issues. Okay, but for family issues, like the marital issues, then they would have to go to one.
Right. So then I would meet both of them as a couple.
Right, as a couple.
Interesting. Toby.
I'm curious why an Orthodox male would want to come to an Orthodox female. That tells me something.
Yes.
Again, I'm not sure, but what if it was...
I'm very suspicious about that.
In what way?
Because if it's a secular guy and he comes to, to an Orthodox woman, okay, there's no chemistry, I don't know if chemistry is the word. There's nothing there. But an Orthodox guy who's coming to an Orthodox woman, seriously?
Not going to work.
I agree with Toby, yeah.
It's a red flag. It's a red flag.
Right.
It is.
Malka.
Yes. Yeah.
Yeah. In my experience, sometimes, I know in particular there used to be in Muncie a woman therapist who specialized in a specific area of therapy and of treatment, and I know that like even a yeshiva would sometimes refer people to this Orthodox men to this particular woman because of what her specialty was. So I can understand, walking into a clinic, and if there's a choice between a male and a female therapist, if an Orthodox man chose a woman when there's a choice, then I agree with you. That would be like a little bit funny. Another thing to consider is that.
Would you do it? Would you do it? Would it be feel like a violation to you of any kind?
No, because if I'm boundaried and I understand my position as a therapist and my sense of objectivity, then I would probably discover pretty quickly why it is that why this man, preferred a female therapist. There are some men. Sometimes a man has had issues with male authority or with their father or with abuse, and sometimes they feel so utterly unable to open up to a male that sometimes they need a female because sometimes she's more like a mother figure as opposed to a male. So I know of situations like that where men have needed to go to a therapist. So for me personally, if I was a therapist, understanding my role and understanding who I am, I would assess why it is and maybe discuss it, given who he is, maybe why that was his choice. And if I felt that there was something that was inappropriate, then I would maybe discuss it with a supervisor or something like that. But I don't see anything wrong with it, especially if there are certain females who have a lot of experience in specific areas and fields which I know in particular that can be that has been the case that I have seen, and that it's been perfectly acceptable for a man to go to that woman type of female for treatment.
So let me try and paraphrase all of this. You're saying that there's no ideological issue. It might be a level of discomfort on both sides that would prohibit that kind of a moment, that you might be uncomfortable, or the male might be uncomfortable, the man might be uncomfortable about that, and really feel much more comfortable with another man rather than another Orthodox man.
Or not.
or not. But there's nothing, is there anything from a religious perspective that would say this is absolutely not going to happen, or absolutely should not happen?
The one prohibition that exists within the Orthodox Jewish community is for a man and a woman to be alone together in a room. Now, that doesn't necessarily include a doctor or a professional. So it's called yichud, which is, you know, there is a prohibition of men and women being together in an enclosed space, but there's definitely a way to deal with it. Sometimes people have the door open a little bit, or, you know, just something so that you're not just enclosed in a private place. But again, it depends, you know, it depends in a situation where there's a practitioner, which essentially you are, and a client, it may or may not apply.
Miriam, you wanted to say something?
Yeah, so first, you know, what Hannah was saying, there was a story in Borough Park recently. I don't know the exact details because I try not to listen to these things, but there was a male social worker who married one of his patients. Like, he divorced his wife with a bunch of kids and married his patient. It was a huge scandal in Borough Park recently. I don't remember when.
A huge scandal in Old Westbury, where I live. Forget about Borough Park. That would
right.
No matter where you live. But even
right.
more.
No, but this included like 11 children or something like that. It was so there is something to it. But on the other hand, like, my father told me that he once had a patient, a client who came into the room and she wasn't really dressed very, you know, covered. And Brazil is a hot country, so, you know, she wasn't very covered. And he had told her, you know, I'm sorry, I'm a religious man, and when you come here, I sort of expect you to be dressed, you know, to be fully covered, and, you know, at least, you know, a little bit of sleeves and, like, you know. And she really respected him for it. And, you know, so I would do something like what Malka was saying. I wouldn't say that I wouldn't accept a male client, but I would definitely, you know, do something extra, either leave a window open or not the door open, because, you know, you do need privacy, and everything is confidential. You know, you can't really have people walking by, but something extra so that it's visible for the client that there's this extra, you know, right.
Okay, Esty and then Malka, and then maybe we should move on. But it's an intriguing discussion because I think you will be confronted with this. It could well be that a man comes to the agency, an Orthodox fellow comes to the agency, and all the male social workers are overbooked, and you're going to get the call, and it could be very uncomfortable for both of you. Go ahead, Esty.
And maybe I sound crazy, and everyone probably can't imagine this happening to them, but I have heard that even female therapists could, you know, feel a certain, I mean, with a female client, and a female therapist can have this kind of thing happen also. So it's not only with males. I think that as a therapist, the person has to be able to have boundaries. That's why boundaries are so important.
Yes, agreed. But I think this ratchets it up a couple of notches because there are some prohibitions about it. And so it may be more complex than we really realize. And it may be uncomfortable for some of you. You're saying that it just might be. And then Malka is saying, well, but you know, some of you are saying we have to get past some of that. It's confusing, and confusing to me, I think, more than not. Malka and then Hannah.
So I have a question. Is it professionally okay to have a camera in an office? I think that would be a boundary that would put everybody at ease in a way where, you know.
To make sure nothing untoward is going on, is that what you're saying?
Yes, I think it would make even the therapist, it would automatically be a subconscious boundary to everybody there that nothing gets crossed. So I think if we put that into a beginning, like, I think it would kind of allow us to deal with such a situation, as uncomfortable as it may be just because we're not exposed to it. Yeah, but it would right away sort of establish a strong boundary. You know, there are eyes here in the office and it's obvious. So we're both here on stage.
Well, who's going to look at that video?
So that's my question. Professionally, how can you do that?
Who's going to look at that? And what would we do with that? And first of all, you couldn't do anything like that without permission. But
That's what I'm asking. That's my question.
Any of that would necessarily address the concern.
Because I know personally, I know a rabbi that in a community, he deals with a lot of women, and you know, sometimes it's very tough situations, and he puts cameras in his office for himself, but also for the people. You know, people also will make scandals, and they didn't necessarily happen. So again, there's a camera for that. We may not look at it on a steady basis, but if needed, I'm just wondering professionally if that's an option.
I don't have an answer. I suppose
Can I say something?
Go ahead.
Oh no, so there's an Orthodox psychiatrist here who they really wanted him, like I said, we're limited in Toronto, they wanted him to see for Orthodox women. So he tells the From Women to begin with, I have a camera here and my wife can check in on her phone from time to time to make sure everything's okay. And are you comfortable with me going ahead with it? And that's his stipulation before seeing this Orthodox client. This client will sign in or sign some kind of a contract. Yes, she's aware that his wife might check in to see what's going on from time to time. And he's constantly videoed. And he does that. He actually practices that.
All right, so I guess it's doable. Sarah, haven't heard from you.
So just taking off on what Malka said, it would be, I would think that it would be just a great protection for the therapist and client. Like, it doesn't have to go further to anybody else. It's just to say, look, I want to be accountable. I want to feel comfortable working with a male client. You know, if you think that I can be of help to you and service to you, then we need to have this boundary. And it's such a fantastic idea. And there's a safety to it, because if it's only would be for the therapist to look at, then that's a safety. And then, God forbid, if it needs to go further, that there is accusations, then you know, they have this proof.
Legitimized.
Right.
Yeah. And then Chaya. And then we have to do something else, as intriguing as all this is. Go ahead.
I'm happy Malka clarified, you know, the law of yichud. I knew there was something to it. And, you know, that, you know, male, women and men should not be in the same room together, but you could leave a door open. And what she was saying about male sometimes needing a woman, she's correct about that as well. I'm remembering where I had a high school principal he sent me a boy. I mean, he was like 6 feet tall, and I was just starting then. And I was like, and he said, like, this boy was getting abused by his father, and they had tried a male therapist, and the male therapy wasn't working. So he did need a woman, and he did well. That being said, I remember that a guy once came to me, actually about like in his 60s perhaps, or 50s, I'm not really sure. And he came for a parent session. He wanted a first initial consultation. And I had asked for the wife to come, and he said the wife's away, etc. So I said, okay, initial consultation for his child. And he came under false pretense. And he started telling me he was a guy with what I would call in the religious world, Shmona Begadim. Like, he had all the layers of being ultra, ultra Orthodox, the code and the tzitzis and who knows what. And I was so thrown off. He said how he's been having affairs with secular women, and now it's not doing it for him anymore. And his wife doesn't know he had kids, and now he needs Jewish women. And he had come there looking for something. And I was just like, I just had to get him out of my office.
Wow. Chaya, BG.
No, I was totally thrown off by what Hannah just said. No, but I think just with yichud also, I just want to clarify, if you can have a door closed if someone can walk in unexpectedly at any time. So I think if you let your client know that you're going to have someone coming in, the supervisor coming in, and at any time during the session, that automatically, first of all, can, prevent anything from happening. but even with a camera, it doesn't have to go anywhere. I think subconsciously, if you know that you're being recorded, it's just, I mean, I think it's very normal. Like, just imagine yourself in an elevator. If you walk into an elevator and you notice a camera, you act differently than if you would be in an elevator without a camera.
I have another, I mean, the camera would be certainly a protection, so to speak, against anything untoward.
I'm saying if someone doesn't, if the camera is, you know, it has to be okay with the client and with the agency. But I think if you can ask your supervisor, he doesn't have to, but to just pop in, you know, whenever he wants.
Well, that would be awfully awkward, but let's, I mean.
Not even pop in, just open the door.
I want to take this to the next level. Okay, so we'll assume that the camera is the protection that everyone feels comfortable with, and assuming that the client agrees to it, and all of that is, as we say, kosher. But the next question I have would be, would there be only initial hesitancy to be forthright, or do you think in time it would be comfortable?
So I happen to know someone who my father has been dealing with, and he has tried male therapists, and he was not successful, and he went to someone now who I actually know personally. And, you know, I can just tell you, he's going to see Mindy Blumenfeld. I think a lot of people know who she is. So my father made a comment to me, and he said, like, I don't think I would be comfortable with you seeing grown men. And I think it's also, especially in our community, it's, again, like, you know, a few people mentioned, I think it's a certain security also when you go to women, like, go and you see a woman, especially because our community, I think that, like, the women, like, they hold the men together. So a lot of men feel secure knowing that they're in the hands of a woman. You know, it could be just in their because, like, we take care of their physical needs as well, just even in the home.
Yeah.
We take care of their needs, and because I think men feel like women provide for them, I think if they have a sense of security as well.
So would that make it difficult to be confrontive, to be in any way push the envelope a little?
So, like, in this specific case that I know that, like, it's normal. But, like, when I think about it, like, I do feel awkward about it. Just because we don't have interactions, you know.
I realize that, which is why I'm curious about it.
So that's why I feel, Professor, that it's just another, I feel like if boundaries are put into place firmly, it's just another exploration in the field, the same as there are going to be a lot of situations that we as social workers may be confronted with and we're not comfortable with it.
Yeah.
So again, we have to be able to, like the book said, we have to know our feelings about it, right? And know, like, this is a man, I may not be so comfortable, so I'm going to put a certain boundary, and then I take myself out of the picture and I focus on the client. So I think it's just another situation, as long as we do the boundaries, of course. As to, you know, if we're going to be confronted with gay people, it's also going to be an issue.
Of course.
That's a social worker's job of how do I deal with my values and not let it come into the room in session.
Being conscientious about boundaries prohibit certain discussions.
Right. So probably it would, to a certain extent. You would not be able to get too personal on certain areas. It may become very uncomfortable, you know. I can see myself seeing a man, and if it progresses past the point, I can see myself saying, you know, this is taking us into a very vulnerable place. I do not feel comfortable going further.
Simi, go ahead.
Thanks. This is actually a message to you, Professor, and to the class, but we're talking a lot about people's comfort level, right? So a lot of this does have to do with comfort level, but it also, like, I think as a Orthodox women's cohort, we're going to be faced with a lot of, you know, things that will make us uncomfortable, but certain things have to do with discomfort, and certain things are not okay according to Torah law. And I actually think Sarah Schneer, I think I'm actually going to ask them if they can have someone maybe talk to us about these situations we will likely encounter, because it's not just with men or people who are gay or different things like that. I think there's a bunch of different things that we might encounter, and if we have a certain level of clarity how to go about it and deal with it properly, I think that is a good start. So
interesting. Kaya, go ahead. Go ahead, Kaya. Kaya BG, you're on. Yeah. Kaya, go ahead. All righty. She's frozen.
Can you hear me?
Go ahead.
Can you hear me?
I can hear you, but you're not moving on the camera. Go ahead.
Oh, there we go. No, I'm just saying I learned about this my first semester. Also, just that we have to trust our own level, and if we have to trust ourselves in knowing that we can be successful with a client. And I think if you have, as a social worker, in any, even in the secular world, I think if you doubt yourself, then you can always just, refer your client to someone else. I think especially in the beginning, it's going to be hard for us to get used to dealing with certain situations that we're not used to because we're Jewish, or just the way we grew up in certain areas. And I think until we get to that comfortable level of being able to really listen to people without bringing any of our baggage into the room, really it's just the smartest to, give your client over to someone I don't know, even just me, one of my options of internship was a sexual abuse clinic, and I felt like as a first-year student I would not be successful. I wouldn't feel comfortable enough to be able to be successful. So I told them, just because because I don't believe in myself enough to be in that situation, I don't think it's fair to the clients to put yourself in that situation.
Well, it certainly leaves us kind of scratching our heads a little bit. Certainly,
sure.
Malka suggestion of a camera, if the agency wants that. I mean, it could be the agency says we're not going to spend that money, for example. I don't know how these things would get managed, but I think that it will undoubtedly occur that sometime a male will be assigned to you, and it will probably provoke certain kinds of reactions that have to be dealt with one way or another. On both sides. I don't think it's so simple for a man to necessarily be vulnerable in a certain kind of a way in front of you as well. It might be a little bit easier because of what was said in terms of the role of the woman, but even so, it's to be given thought. And I'm not sure what the norms would be in terms of agency life, but to be explored. Interesting question. Let me go on, and let's take 5 minutes. Take 5 minutes to a bathroom break, and we'll be back.
That was interesting.
Hiya. How are you doing?
I'm good. I was reading through those 2 chapters of Schulman, and they seem so overwhelming. I see you're breaking it down to make it seem a little bit easier, but between all the first assessment, middle, and it seems very overwhelming to go in and have to.
Yeah, I'm going to try and make it a little bit easier.
Oh, is that what it is? Okay, good.
There's a lot of content there. And Schulman tends to be a little wordy, in case you haven't noticed. Okay. But well-intentioned, needless to say. And a lot of what he says is quite well done. But it's a lot. And the reading for the next week or so will be a little bit easier. But, I mean, you know, it's a little bit hard also to absorb all the readings unless you have it integrated into a placement opportunity. You know, you don't have the opportunity to apply some of what we're talking about. And that's too bad. And eventually you will. It'll all get pulled together. So it becomes very abstract. The reading becomes abstract, although I know he's got a lot of examples of things in the chapters that explain stuff. Nevertheless, it feels very...
yes, abstract is the right word. Yes.
Hello, Esty. How are you?
Hi, just checking in. Everything okay?
Humming along. We had a very interesting discussion.
I heard the male therapist, the scandal.
It occurred to me as I'm speaking, I'm saying, wait a minute, how is that going to play out?
But I think, Professor, I think it's going to play out the way everything in social work is going to play out for us. You know what I'm saying?
No, how's that?
Because it's an exploratory field to begin with. We're going into something we don't know yet, meaning we're going to have contradictory feelings on so many things that we may be exposed to. But I think as we get, like Chaya said, as we're going to get more comfortable in the field, it may not take us over that much.
Well, that's true. I can attest.
And in the beginning, yes, it is going to be the safest thing in the beginning to put ourselves in the least vulnerable situation, just to gain confidence as a social worker.
Yes, you're right.
I believe that's something.
It's new. Everything is still new.
Right.
And slightly uncomfortable because you've never done it. It's like any new skill. But conceptually, the idea is, I think, rather intimidating.
I personally asked to be interned outside of the community for 2 reasons. I think it's going to give me more it's going to open me up to a larger
exposure.
Yes, it will.
Exposure. And also it's to avoid being uncomfortable by dealing with people in the community that I know. I'd much rather prefer that, we both stay out of it, not me and another client. I would not be comfortable.
Yeah.
So that's how I just asked Professor Ackerman. She, I made it a little tougher on her, but I said I'd rather travel than work in the community.
Mm-hmm. Okay. Well, it's an interesting discussion. All right, as soon as the rest jump in.
I'm going to make an interesting point also. Someone mentioned this earlier also, how, I think it was Esty, how sometimes I feel more comfortable talking to men outside of the community than in the community because men and women really don't interact that much.
Yes.
So.
And I'm sure that this reverse might be true as well, that men in the community might feel more comfortable speaking to women who are not in the community. I would imagine. No?
Also just because of judgment.
I agree with that, Professor.
In this class, we're going to get to see, we're going to get to see maybe some of the, worst parts or, some parts that aren't as, the community gives off a very sheltered, perfect look, and we're going to be exposed to the imperfect sides of it. So I don't know. It's very, I think it's also very personal. It's based on a person's culture. And within the Jewish community, there's so many different cultures and families, and the way a lot of families, the men and women in the families don't interact either. So I think it also depends on, the actual person's family and background and what their comfort level is as well.
Well, time will tell. As you move further along in your placements or begin your placements and move through them, I am sure over the next 6 months, we will have episodes that will be new and hopefully challenging in good ways to you.
Right.
All
We will
around.
definitely consult with you.
Well, that's why we're here.
Absolutely. I would come privately to you, Professor, to learn. I really would do that just to learn from that. I think that's amazing. There's nothing that an experienced person cannot give over to a newcomer. I think there's something so beautiful about that. So, and class is not going to offer enough for that.
Well, all right. Let's move on. We only have a short amount of time to cover a lot more material. Although I think this might have been perhaps more intriguing and hopefully more educational for you than some of what we're going to talk about. Nevertheless, and this all began with, can we talk about medical problems? You never know. You just never know. Okay, so let's talk about the client who comes in with some kind of a problem. And so, again, something might take a half hour. The client may take a half hour to explain the nature of their problem and some of the history. It can be subsumed or abbreviated to 5 lines. For example, let me read a possible one. A 41-year-old female with a major medical issue, is a divorced mother of 2 young girls. She's currently unemployed and is suffering with anxiety and depression. She has been unemployed for the last 6 months and states that her depression is worsening over the last couple of months especially. That's a comment, that's a description of someone's presenting problem. So you have a thumbnail sketch of what it is and how long it's been there and kind of what the, quote, symptoms of it are. Then we move on to looking at what, again, makes our assessments very different from diagnosis. We look at some of the strengths. So we look at, tell me about your family, and hopefully we're tapping into something that's very positive. Who are you closest to in your family? Tell me about your social supports. Who are your friends? Do you have friends with whom you confide on a regular basis, that you see friends on a regular basis? Within your family, who do you feel the most comfortable with? What gives you strength in difficult times, which might touch some of their spiritual life and their religious life? What gives you strength? These are all strength-based questions. And again, not necessarily going to be part of your assessment if the agency is not looking at it, but it may be well part of your assessment for you to have in your head about this person. Even though you don't have to write it up into page after page, you're going to say to yourself, oh, it sounds like they're pretty well grounded. They've got a couple of friends, their family is very close, their husband, wife is very close to them. Things sound pretty, they've got a pretty good solid support system. That's something you want to know. Because when things hit the fan, invariably, people will rely on others to help. But if that isn't complete, that's when they're going to see you. Nevertheless, you still want to know that there are people out there for this client. You want to know about the family composition. What's the nuclear family? What are the significant relationships? How long have you been married, if you're married? Any divorces, deaths in the family? Where's your family of origin? And, just getting a sense of the family structure, whether it's completely intact, whether there's been divorces. One of my current clients right now, and again, most of my clients are from the secular world, if you will, and she comes from a divorced family. One of her children, grown children, is divorced, and she is struggling with a whole bunch of issues. But the fact that she comes from a divorced family and her son is divorcing and divorced, it almost norms the behavior. And you would want to know that there's been some issues around relationships in her past, and in her present, her son is in the midst of a divorce. So this might have, again, these are little tiny pieces of that jigsaw puzzle. It's a 5,000 piece jigsaw puzzle. Each piece of information fills in a spot in that jigsaw puzzle. So you would want to know history, family history, again, very broad-based kind of content. If there are children, you might want to find out the history of the pregnancy. If the woman has had multiple pregnancies, were there any complications? Did things go smoothly, et cetera, et cetera. Educational history. Again, are you dealing with someone who has been a scholar? Or are you dealing with someone who went through school in a regular way and everything was fine? Did they have any educational challenges? Were they ADD or any of that kind of stuff? You would want to know these pieces. These are all pieces to someone's history. Their employment history. Have they been employed? For how long? What have you been doing? Are there any special skills that you have? The daughter of a client of mine is a brilliant IT person. This woman could run the world. She knows more about computers than all 14 of us on this screen right now, doubled. And then I think, just to broaden some of the categories, what are their religious activities? Are they deeply immersed in their religious life and in their religious observance and their beliefs and the activities of their religious life? How are they articulating that? Social and recreational interests, significant relationships. Who's the most important person in your life? That's a question. Marriages. Who's living with whom? Significant others. Let me think of this. Any more I would want to just throw in here. So essentially, what is gleaned from the assessment? You want to know if indeed this client has anything striking in their past that might be influencing the present. Now, I'm not talking about a whole Freudian analysis, but something, for the woman I saw at 4 o'clock this afternoon, the history of divorce in her family. Her son is, as I said, in the midst of and almost divorced. It has caused her a tremendous amount of heartache over the years. She is in a marriage that's so-so, and almost lives in fear of being abandoned. It's more information than perhaps you would need to be able to understand this gal, but the fact that she comes from a divorced home, her mother remarried, she had to live with a stepfather whom she did not care about and did not like, and it had created for her issues in terms of attachment and so forth. I would want to know something like that, not in tremendous detail, but it may explain her current angst in terms of her own marriage, and certainly her despair over her son's divorce. So you're going to go through all of these questions and more. And again, it's going to be very agency specific. And then you're going to say to yourself, well, what do I do with all this information? And this could be, again, over maybe 1 or 2 sessions, with more information perhaps garnered in the second session about the presenting problem, and ways that they have tried to address the specific problem, how long it has been going on, what was helpful, what wasn't helpful, why did they seek help for this problem? If they did, how did that go? Did they see another counselor, another social worker? How did that go? Et cetera, et cetera, et cetera. So you're going to gather a lot of information, including, some of the basic life necessities. Are you living in, is your home comfortable? Are the finances of the home adequate? Are you able to relax a little when it comes to buying things? Are you able to be comfortable in your space? And so all these pieces come together. And what you will say to a client probably would be something along the lines of kind of restating. So what I hear you telling me is that you're going through a very difficult time, that you're very concerned about your relationship with your husband based upon the fact that you're a child of divorce and your son is in the midst of a divorce, that financially things are okay, you're working, you're a lawyer, et cetera, So you would restate some of what you've heard, usually after the first or second, especially with adults, the first or second session. You would say, try to summarize what you think are some of the causes of the difficulties and what you hear as the most important factors that are affecting the problem. I hear you telling me that you really feel very lonely, that you have no social supports, and that can be a really difficult situation. So you feel very alone. So again, I think hopefully you're getting the feel of this, that the pieces start to come together to form a montage, if you will, of somebody's life. And we are also looking, and this is again what separates us from those who do a diagnosis, we are also looking at the strengths, and those need to be enumerated as well. Those need to be commented upon. I also hear that even though you were struggling, that you have, for the most part, kept up your financial obligations, you've kept up some of your religious obligations, you've kept up some of the spiritual side of your life, that you tend to be very interested in intellectual things. You want to kind of wrap it up, not with a bow, but to kind of just reflect back to the client both some of the struggles and what you hear as some of the strengths. You've been through some very difficult situations in the past from what you commented on. I am hopeful that some of those strengths will transcend into the current problem. And what you try to do is try to mention, if you can, what might be some of the protective factors to help them go through this particularly difficult problem. Then comes a much more thoughtful time in which you have to, in some way, reflect back and say, well, you know, after having spoken with you, my recommendations might be the following. That, and again, this is done very collaboratively. You're not laying out a roadmap that they have to follow, but you are trying to make some suggestions. You know, it might be helpful if we looked at some of your social contacts to see how that part of your life could be strengthened. It might be helpful to look at some aspects of your relationship with your extended family who might be able to be more helpful in terms of dealing with this problem, etc. So, but this is just your thinking, and you might kind of wrap it up and say, you know, how do you feel about some of what I'm suggesting, that we might want to go down these particular areas? Does this gel with what you have in mind? Do you understand also, and maybe this has to be said maybe even earlier on, do you understand how this counseling situation works? And many people who've never had counseling before may be totally confused about how this all, you know, they're thinking about any kind of a counseling relationship. Could be based either on a movie or a book they read or something that they've heard, and they don't necessarily really know what this counseling thing is all about. So often, very early on, I will ask, have you ever had any kind of counseling before? Well, no, I really haven't. And then I do my routine, which says, well, you know, basically, I ask a lot of questions, and you think about those answers, and then we kind of formulate some way for us to be able to assess your problem, and we talk a lot, and that's how this works. I'm going to help you to try and understand some of the basis of your difficulties and help us move forward and move you through them. But something has to be said to the person who's a total novice about ever having sat across from someone in any kind of a helping way. Miriam, go. Miriam. Miriam. Hello. Hello, Miriam. Are you with us? You guys can all hear me, right? Miriam, can you hear me? Miriam Weinfeld.
Oh, me? Oh, yes, I can hear you. I didn't raise my hand. I'm wondering. I thought it was the other Miriam, but no, I now realize that she's not in this.
Okay, I thought your hand was raising.
No, sorry.
Okay, no problem. So how do you feel, guys, about explaining what you do, even though you're not even 100% sure what you're doing? How do you feel? I mean, again, it's very simple. I ask a lot of questions, and you answer a lot of them. And hopefully in the answering of some of my questions, it becomes clearer about a path through this difficulty and maybe some of the predisposing factors that created this problem. It's a very 1 or 2, 3 sentences, but again, a lot of your clients may have never had any kind of direct experience with anybody in this kind of a way. And they're very tentative and they're very problemed. So they say, I really have no clue what this is really going to all be about. And that's totally understandable. So you need to have some kind of an explanation or a stock explanation that people will understand and say, oh, okay, all right, I get it. All right, ask away. And any of you who have never had counseling may find that you too are a little confused about how all of this works. And, you know, again, this is a whole new discipline for you. And for the most part, we look at how this interaction takes place between you and another person. And we talk all about empathy and trust and all that good stuff, and how you try to almost ingratiate yourself with this new client, which is great. Fine, that's what we're supposed to be doing. But then the question is, and then what? And the and then what is where the assessment package starts to begin, and where the questions of the assessment start to have more meaning. So again, you have, let's put it this way, you've won the interest of the client and you've won them over, so to speak. And I'm not necessarily saying anything ridiculous. I'm saying you've now established yourself with the client as a nice person and they want to talk to you. Great. And many times you'll say to yourself, well, now what am I supposed to do? And even after the assessment, now what am I supposed to do? And over the next week or two, we'll have answers for some of that. But then the question for you is, well, what do I do with this information? How do I proceed with this person to really address what I'm hearing? How do I pull these pieces together? The history, the medical, the family relationships, the support systems, the strengths, the weakness. How do I pull all that together? So you have to stay tuned on Tuesday night to the Beater special from 8 to 10 on Tuesday nights to figure out how to move along with this, because again, it's somewhat confusing. And I can appreciate your naivete about, man, now what? And that kind of a, now what kind of moment. After you've done the assessment and you've given them the whole spiel, and next week we're going to talk about how you do a mental status exam, which is another aspect of all of this. What kind of questions do you ask? And what do I do with all of this? That's when that moment kind of comes along. However, let me just put it this way. It sounds more complicated than it is. After you have had 1 or 2 sessions with someone during which you have asked a lot of these assessment questions, and you are empathetic, and you're looking for strengths, and you're aware of boundaries, and you have all the eye contact, and the room is set up in a certain way, and you've asked all the right questions in the right way, it starts to flow. Trust me, it starts to flow. Okay, first Malka, and then Malka.
What does that mean?
What does that mean?
First Malka and then Malka.
Oh, you're Malka. Oh, I want the other Malka. Her hand went up first. Go ahead, Malka.
Yeah, I wanted to ask, you know, when you're initially meeting a client and you're speaking to them, you know, and you're, you know, telling them that you ask questions, do you ask them what their hope is or their expectation? Because, and have you ever experienced some interesting, you know, I mean, I guess it may be too important to see what, you know, I guess when you ask them what prompted them to come in, but what their hope is and what their expectation is?
Well, it sometimes gets transmitted. I don't know that I ask it specifically, and maybe I should. It's probably a very good point. And we can almost guess about what those.
Right. I mean, it's kind of self-understood. I mean, that they came in, you know, because they have a problem and they want help, and they're, yeah, you know, but you never know. You know, I mean, it's, you know, it's.
I can't necessarily say. I'm thinking of some of the people in my package.
Maybe they just want someone to talk to. You know.
Well, that's, yeah, I'm just thinking of this one woman who has a very complicated problem. I don't want to tell you too much because it would be somewhat breaking up our confidence, but the broad strokes are the following. She had artificial insemination. And the situation was that there were 3 embryos, and she did not want 3 children born at the same time. She didn't want triplets. And without her husband's consent, she had one of the embryos withdrawn. And now these twins are now 16 years old. And out of no place, she felt inordinately guilty about what she had done. I don't know. I still don't know. This is very early on. I still do not know what provoked that guilt. But she's feeling guilty. And she has never spoken to this to anyone. She wanted to talk to someone. So there you go. And the range of problems is infinite things you can't even imagine. I'm sitting there like, really? Wow. I don't know how to respond to something like that. Not that she's asking me to, but internally, I'm not even sure how to respond to that. But what she's saying is, I need to unburden this. It's like going to a priest in confession or something. I need to have somebody tell me it's okay, basically. But again, she's been tortured, not tortured, but of the last year or so. And I've only met her once. So I want to find out, what happened to provoke those feelings out of no place? Or have you always had them? And I don't know. Malka O. Oh, it's on the telephone. Okay, never mind. But as I say, this skill that I think some of you are probably worried about, once you've kind of met someone and heard some of what they have to say and done the right things, all of which we've spoken about, it starts to flow. Because for the most part, I think clients really want to tell their stories. I think they want us to be the repository of the secrets. So in our ethics case, after 10 sessions, she felt comfortable enough to share this secret about her secret life and the jurisdiction, running out of the jurisdiction and setting up an alias and all of that stuff. She wanted someone to know this. And I think we have to make the assumption that some of the things that we hear will be things that they have not necessarily told too many people. Or if they have, they really haven't found either a resolution or absolution or whatever. They haven't felt right about it. They still had to go further. And that we become the repository of lots of secrets, which can be difficult. Yes, Esty.
Sorry, my question is just, let's say somebody comes in and you want to ask them questions and they don't want you to ask them all these questions. They say, I just want to talk. Like, I don't want.
Well, yes. I mean, all this information stuff, all this assessment stuff, you don't want to. You could negotiate. Can we ask them? I just have to get this stuff out of the way because the agency requires me to do it and blah, blah, blah. I mean, you could blame it on the agency up to a point. But I think you also have to, I think what you're also asking is, how do you deal with someone who's really very resistant? Not necessarily about the specifics that you need answered, but in a broader sense, many clients don't want to talk. And they'll tell you that they do, but they won't tell you. In other words, one of the most common dodges, if you will, of a client who doesn't want to tell you something is you listen for shifts in the conversation. So it may be, yes, I have this problem in my family when I was artificially inseminated, And she's going on. And then there's a real shift into, well, my parents never knew anything about it. I mean, you get what I'm saying? There's like, it'll be going down one trail and then all of a sudden it makes a 90-degree turn and you're saying, what happened here? That means somebody doesn't want to talk about something. Early on, you put that in the back of your head. When you're well established, you would say, what happened just now? We were talking about your artificial insemination experience, and then you were talking about a baseball score. What happened? But early on, you can't challenge that because clients will get very uptight, and they may not like that you're questioning them and pushing them a little. But later on, you have every right to say, I don't understand what happened to you. You know, did something occur that made you not want to talk about something? You would question it because it's safe now to challenge a bit. But in the beginning, if they don't want to answer, you can't make anybody do anything. But you could say, listen, I have about 5 questions. Can you just let me get through these? And just make it the agency's problem, not yours. Any other thoughts? Go, Malka. Oh.
Sorry about that. So my question is, as a beginner.
Yep.
So obviously we are feeling vulnerable as a beginner. And what are the ways it's okay to be vulnerable, but you cannot, you can't tell the client, I'm really new to this. I have no idea what we're doing.
I have no idea what I'm doing.
Yeah. So how do you kind of take in those feelings, which will make a difference? You kind of have panic almost of, can I actually do this? And then still be human. Okay, I am allowed a certain amount of room for error, right? I'm saying as a human being, not as a beginner.
Of course.
I'm saying allowing, to say, so how do we play this out?
Well, what's often helpful is you have in your back pocket more questions. And I mean, I don't know that I would ever say, I don't really know what I'm doing. I don't think that would inspire confidence, but it's a feeling that you have. I'm not sure where I'm going with this. Okay. I think what we have to rely upon, when you wrote your paper asking for help, what hopefully came out of the experience of asking for help was the fact that you felt relieved of some of that burden. I think we have to assume that our clients will feel relieved of some of their burden. And it is okay to ask them more questions about themselves. It's okay to embellish the problem and how it manifests itself. And what about the cast of characters in your life and how are they responding to you? It's okay to have in your back pocket a couple of stock kind of questions that expand the discussion somewhat. Maybe what we'll do next class is a role play with some of that and have one of you be a client. And we did that already, so maybe we can do that again. Didn't we do that, Hannah? Then weren't you maybe we'll do another one of those and kind of someone will get the feel of what it really feels like to be a first-time client and to be a first-time social worker speaking to that first-time client. And how do you get all this information pulled together into something that ends up being somewhat coherent? So we'll play with that next time. Serious play. Let me talk to you about a couple of things. You have a couple of assignments that you cannot do because several of the next 2 big assignments are all making the assumption that you're in placement. And since several of you are not in placement, I have to create a sort of an alternative assignment for you to work on. Do not do anything unless I tell you. If it says respond to other people, don't do that unless I tell you to do it. Apparently it was in the assignment for the case study and said respond to 2 of your Don't do it unless I tell you. And then when I saw it, I got rid of it on the assignment. So only do what I say. So at this point, I'm not going to have you do any further assignment until I create a new one and or more of you are in placement.
Can you just keep Passover in mind, Summer, with the dates? Okay,
no, I know that. I know that. I have it on my calendar.
Because otherwise, some of us would get a jump start now and start working on it if it was available. That's all.
I mean, it's quite a few weeks away, and again, I think everything kind of takes a halt for about 2 weeks during the whole Passover time. I understand.
2 weeks before.
Oh, really?
So next week is Purim also. So.
All right, I got you. All right. So
forgive me. According to, I brought it up a couple of weeks ago. According to the schedule, it does say that we do have something due right the day after Pesach, and it's also a time that says to make up any work. So in those 2 weeks that we have off, I don't know if any of us are going to be making up any work. I guess I just wanted to know clearly what's due before, or if we can have access to it now, so that.
Yeah. Esty, I think you and I will have to sit down on Thursday and go over some of the dates to make sure that there is no difficulty with that. Go ahead.
Right. I've spoken to Bela, and Bela's kind of like paskined on this, that we all know what's kind of coming. Nobody's really going to do work over Pesach. That's how this program is formulated. But what she did say is that I guess we may have to open the modules early, Joan, because maybe the work's going to have to be done before Pesach, because there is a schedule.
Okay.
And no, that it doesn't have to be turned in beforehand, but they may have to. It's going to be a little bit rough, but it may have to be done before Pesach.
Okay.
Esty, can I present a question to you? What happens with internship over Pesach?
Sorry, I was muted. Sorry. So internships over Pesach is that we set up our program so that you don't have to go over Pesach. Some people are going to choose to go Chol Hamoed because you want to be able to catch up. You know, you don't want to be so far behind. That's people's choices. We're not forcing anybody to go, and the agencies that you're going into are aware of our schedule, or at least they should be aware of our schedule. And in Mitzvah Shem, it should be, it should be easy and seamless. You're going to maybe have to remind them in a respectful way, but you can't go in demanding, this is Pesach, I'm not coming, like the head bobble, the whole thing going. No, it's not going to work.
Can we work on our own schedule and maybe ask them if we can work an extra day? Like, the weeks before Yom Tov?
Absolutely. But again, Chaya, they don't have to accommodate us. They know about Pesach, and I'm sure that they're going to work with us 100%. Yeah, okay. But just remember, whatever you do, all eyes are kind of on us. All eyes on Sarah Schneer, all eyes on us. So however you go in, you want to make sure that if you think you're being respectful, even maybe dial it back and say, I'm going to add a little extra.
Mm-hmm. Okay, thank you.
Okay, so what I'd like for next Tuesday, no written assignment, but I'd like you to read Hepworth chapter. There were some page numbers in the Hepworth assignment for last week, which didn't coincide to anything, and it had to do with a different edition. So I'm asking you to read chapter 8, which is, let me just grab my Hepworth, make sure we're all on the same page with this. This is the chapter, again, if you have a different edition, that could well be. Chapter 8 is assessment, exploring and understanding problems and strengths. And it will kind of reiterate some of what we are discussing today. So I want you to take a look at that. In my edition, it's pages 185 to 239. So between the Shulman reading and Hepworth, you're going to have a whole broad base of really approaches to assessment. And where we're moving along will be toward really how do you set the goals, and how do those get put together, and then putting a contract together. So that's kind of where we're heading. No written assignment for this coming week. You get a pass, but come back next Tuesday. Okay?
So also, I just want to let you know, if you guys have any questions or there's concerns, or you can reach out to Bela, you can reach out to me. But we're just, we just want you to know that you, of course, I know you're all reaching out to Bela regularly. But if there's something that you need, please let us know.
Yeah, me too. I mean, I get some of the emails, and if I don't know, I'll get in touch with Esty or Bela. So we're all here as a team. Okay.
Thank you so much.
Esty, stay for, not this Esty, Esty Clausen, stay for one more second. I wanted to comment on your note to me.
Oh, and I want to ask you something also.
Okay, so goodbye, everybody. I'm going to stop.
Thank you.